So it looks like everyone's getting used to me presenting some really thought-provoking topics on this channel. And this next one is no exception, and that is the topic of misdiagnosis. If you do a quick Google search, you'll be able to find that approximately 12 million Americans are misdiagnosed every year. And medical errors are the third leading cause of death. I mean, that is just ridiculous. And what does the word diagnosis actually mean? Well, the word gnosis comes from the Greek and it means knowledge. And interestingly, the word agnosis means a lack of, indifferent to, denial or shunning of, or defective knowledge as defined by Wikipedia. And so we're left with die. What is the meaning of die? Well, die implies that there's two. So are we meant to conclude that the word diagnosis actually means two people who don't know? Is it referring to both the patient and the doctor? And if words have power, what does the term diagnosis actually contribute to? Are we saying that we don't know? Are we affirming that we will never know? I think most of us who have been through the medical system or who have had a chronic illness, myself included, we have received such an education, and the conclusion that many of us have reached is the unfortunate realization that the pharmaceutical industry is one of the biggest industries in the world. Apparently, it's about $1 trillion industry, and it's getting to the point where we can't trust most of the clinical research that's published because we just follow the money trail. I mean, if the FDA is actually approving drugs that are known to cause liver failure, kidney damage, blood clots, it certainly indicates that we need to take a more conscious approach to our own healthcare. So don't ever be embarrassed or intimidated to ask questions. I always encourage people to do their own research, ask questions, talk to others, get a second or a third opinion. This is your life, it's your body. If you are prescribed a medication, please remember to ask questions. What is this medication for? What is the dose? How long do I need to take it for? What are the common side effects? Take notes, bring a checklist, and keep records. And become actively involved in all the decisions regarding your health. Other questions that I encourage you to ask your practitioner include, can you recommend alternatives for this drug? Are there simpler and safer options? Do I really need this test or drug or procedure? How can diet and exercise and behavioral changes improve my symptoms? What lifestyle changes could I make? What can I do to support my healing? I think diagnosing someone and just giving them a pill is quite neglectful because everybody deserves to be educated and empowered about how they can participate in restoring their body's health. People who have been under prolonged stress, people who have been in narcissistic relationships have an overstimulated and aroused nervous system. So their sensitivity will be through the roof simply because their body cannot cope with any more chronic levels of stress. So symptoms are communications from your body to take care of yourself, to pay attention. And yes, there is a time and place for medication, but medication is only meant for short-term suppression. And medicine is an art. It is not a one-size-fits-all approach. And the pharmaceutical industry and all who have been trained and indoctrinated by this industry would have us forget that we have an innate ability within us and that that is the true source of healing. So please remember, your diagnosis is not your identity. It's just a state of imbalance that your body is currently experiencing. So you need to figure out what you need more of or less of to get back into balance. An illness is a process. It is not a static state, which means our natural state is health, and our body is always in the state of healing. And please keep an open mind towards all modalities, because our mind is like a parachute. It works best when it's open. So for those of us who are highly sensitive, who are empaths, and particularly those of us who are healing through narcissistic abuse, we are very sensitive to energies, to our environment, to the tension in the air, and all of that has an effect on our physiology. We so often overlook the impact of stress on our health, yet stress makes every condition worse. And sometimes alleviating someone's symptoms is as simple or as difficult as managing their stress levels. Being in narcissistic relationships or being extremely sensitive often makes us feel like we are crazy, and getting a diagnosis or a label to identify what we've been experiencing can give us relief. But please remember not to adopt a firm identity around your illness. Because when we accept a diagnosis without questioning it, or perhaps getting a second or a third opinion, we are limiting our body's ability to heal. Our brain literally receives instructions from our thoughts and from our beliefs. So one of the most empowering things that you can learn to do is to become acutely aware of your own energy, how to maintain it, and become acutely aware of what fills you up and makes you feel empowered and energized, and what drains you and makes you feel fatigued. And these are all the subtle signs that your body will initially give you. So when we endure, when we ignore, when we suppress these subtle signs, eventually our body will give us louder signs and physical manifestations of that energy imbalance. And this is really revolutionary, but I really want to encourage you to look for symptoms of wellness, not for symptoms of disease, because you will find what you're looking for. And we are so trained to look for symptoms of disease, so why not actively look every day for symptoms of wellness? Acknowledge that you are feeling better. We are not meant to stay wounded. We're meant to hear the message of the symptoms and what they are communicating. Illness is always a call for authenticity and for self-love. And when we participate in self-betrayal or we compromise on our truth, our body will let us know. People who are highly sensitive sometimes ask, am I being a hypochondriac? And my response is, chances are that you may just be acutely aware of your body's processes. Those of us who are highly sensitive are also much more sensitive to pain. We're more sensitive to medications and even to certain supplements. So we may have to start at a lower dose and may not even be able to tolerate a higher dose like most people could. So our constitution seems to be a little bit more delicate, and we're much more easily thrown off balance. And we tend to react to all the subtleties in our environment. Our body will give us symptoms of perhaps anxiety and overwhelm because we've absorbed the residues of some sort of tension and conflict of the people that were in the room. So we just need to be that little bit more conscientious and alert to what's over-arousing us in the environment. Despite what the world tells you or what unaware people want to diagnose you with, our overall sensitivity always needs to be taken into consideration. The reason why I'm saying this is please don't be quick to accept a diagnosis when really it's just a symptom that your body is out of alignment. And yes, drugs, surgery, procedures, they all have a relevance. But I encourage you to always reconnect to the wisdom of your own body and then take inspired action out of love and appreciation for this guidance that is always within you. And never make a decision out of fear, because then we attract more reasons to be fearful about. Nobody owns the right to your body's ability to heal. And a diagnosis only means that they have a treatment or a medication that they could help you with. But please also be aware that there is a lot of profit being made from people's ignorance and fearfulness. Misdiagnosis is too prevalent, and you don't have to become a statistic by becoming a conscious consumer. And let's remember to trust the wisdom of our body sooner and make more conscious choices, because our individual conscious choices create new consciousness.